Welcome to Palace University. This class is Bloodborne Pathogens, how we keep team members and residents safe from infection. Bloodborne pathogens are germs carried in human blood that can cause serious illness. The three main ones we worry about are HIV, hepatitis B, and hepatitis C. These germs can also live in other body fluids, what we call other potentially infectious materials, including drainage from wounds and any body fluid with visible blood. In assisted living and skilled nursing, blood and body fluids are a normal part of care. Dressing changes, a small cut, an accident in the bathroom, soiled linens. Most of the time, there is no infection risk at all. But because we cannot tell by looking who is carrying a pathogen, we treat every body fluid as if it could be infectious. That single habit protects you, your co-workers, and every resident in the building. Exposure usually happens in one of four ways: a needle stick or other sharp object that breaks the skin, a splash of blood or fluid into the eyes, nose, or mouth, fluid touching skin that has a cut, scrape, or rash, or contact with a contaminated surface or item you did not realize was soiled. Most exposures are accidents that could have been prevented with the right precaution. This is the most important idea in the whole class. We use standard precautions, sometimes called universal precautions. Every drop of blood, every body fluid, every soiled item is treated as if it is infectious. Every time, every resident, no exceptions. You do not need to know the resident's diagnosis. The precaution is the same for everyone. Personal protective equipment is your barrier. Gloves anytime you may touch blood or body fluids. A gown when splashes are possible. A mask and eye protection if there is a chance of a splash to the face. The palace provides all of it at no cost to you. When you finish, remove gloves and gown carefully so the dirty side stays on the inside, and wash your hands. Stay alert for the small things: a red biohazard bag that is overfilled or leaking, a sharps container that is past the fill line, a soiled linen bag left in a hallway, wet spots on the floor of a resident's bathroom, bandages or dressings on the ground. If something looks wrong, it usually is. For a blood or body fluid spill, put on gloves and a gown, cover the spill with absorbent material, then clean with the disinfectant on your housekeeping cart. Place everything in a red biohazard bag. For sharps, never recap a needle and never reach into a container. If a sharp is on the floor, use tongs or a brush and pan, never your hands. All sharps go straight into the rigid sharps container. If you are stuck, splashed, or come into contact with blood or body fluid, act immediately. Wash the area thoroughly with soap and water. For a splash to the eyes, nose, or mouth, flush with water for at least 15 minutes. Then report the exposure to your supervisor right away, even if it seems minor. The palace provides a confidential post-exposure evaluation, follow-up testing, and treatment at no cost to you. Reporting is required, and it protects you. Two rules govern this work. OSHA's Bloodborne Pathogens standard requires training, PPE, hepatitis B vaccination at no cost, and a written exposure control plan. Florida's Biomedical Waste Rule, 64E-16, sets how we store and dispose of red bag waste and sharps. The most common mistakes are skipping gloves for a quick task, recapping a used needle, overfilling a sharps container, and waiting to report a stick. Don't skip, don't rush, don't wait. Standard precautions every time. PPE every time. Report every time. This has been a Palace University training.